Welcome back, and we are joined with Ryan talking about NutriMeds and our new latest protocols. Ryan, I want to touch on a new product that's coming down the line. It'll be available very soon. We're actually working on getting it finalized, and this is a neutral pH lactase enzyme, which basically is unique. There's no other neutral pH lactase enzyme anywhere in the world. 80% of the time when you want to destroy lactose, which is important because milk products are in almost all baked goods, they're everywhere, and people who don't have the lactase enzyme wreck their bowel, get leaky gut syndrome, and have many other health problems. It's one of the foundational bases for many degenerative illnesses is the inability to break down milk lactose or milk sugar. So tell us all about it.
Well, yeah, this is going to be a very cool formulation for a lot of people. You know who you are out there. You get a whiff of something that's dairy-based or something in it. And like you said, Dr. Bill, sometimes you might eat something and look back at the product and be like, wow, I had no idea it had that in there. Anyway, our exposure to lactose is pretty common, and for certain people, our inability to digest it turns it into a very inflammatory substance for us, but it's not easily avoidable. Now, there's enzymes in the marketplace where people will see them over the counter all the time to help you break down your lactose and help you with, being able to consume things that are dairy-based much more easily on your body. But what's happening is those enzymes, the lactase enzymes, are working just in the stomach. They're acid-based enzymes. What's unique about this new material is that it is a neutral pH enzyme. It's particularly made in a special way to allow it to work just in the small intestine. And, it works some in the stomach, but for the most part, it is small intestine, where 80% of the lactose is broken down. So what that means is one very small capsule of this material allows you to break down a tremendous amount of lactose and not have this inflammatory reaction, which then leads to upset stomach, gas, discomfort, foul-smelling stools, and then on down the line with with regards to systemic inflammation. So it's
exactly.
Very
which, by the way, drives all
state-of-the-art technology.
Yeah, that's pretty amazing. And we have amazing testimonials too in terms of how people are getting well with a NutriMedic approach. One thing I'd like to do once in a while is to kind of let's get into your favorites. This is the end of the week. What are your favorite nutraceuticals today?
Let's go with, I think today I'm going to say Collagen Max. Collagen Max is a really cool formula because you can see the effects on the outside of the body, hair, skin, and nails. But they also know that it's working dramatically on the inside of the body for collagen, elastin, and keratin. And so when you use Collagen Max for people that, see issues where their nails aren't growing effectively, they're weak, they're brittle, they're cracking, hair thinning, falling out. Sometimes that easily gets put into a category of just saying thyroid issue. However, as we age, one of the things that we have less and less of is what's known as orthosilicic acid, which is silicone that's found in the plasma. And when that's low, it means that the body is unable to basically convert what it needs to into collagen, elastin, and keratin. So that affects our hair, skin, nails. But on the inside of our bodies, like for bone mass, bone mineral density, we know that this material, Collagen Max, is very important. It's been in studies that enhance bone mineral density, and that's because collagen makes up 30% of the bone mineral. And so that's where, like, when you take calcium products, if you don't have a good collagen matrix in your bone, there's nowhere for the calcium to bind to create that hardness that everybody thinks is so critically important. You've got to have this collagen structure. And then when it comes to joint function, that range of motion, mobility, stopping the popping and clicking, right? We've got to be able to produce the collagen in those areas as well. And again, this is one of those areas that people start taking it. They can see effects on the outside of the body, but noticeable effects on the inside as well.
Yeah, that's amazing. Now, I want to turn to another testimonial I just got yesterday of a gentleman who had a very deep sulci and pocketing around their gums, and they started on Allison Med. And within 3 months, all of their pocketing returned totally to normal. Now, I just give you a side note for those listening out there. When I worked on the cardiac wards where we do heart bypass and transplants and so on, all of the ward patients, 100%, had really bad periodontal disease. There's no exceptions. So as soon as you take Alcimin, you're not killing the nanobacteria around your teeth and your gums and restoring the sulci and cavitations, but you're also killing off the nanobacteria in your artery walls that are going to give you a stroke, unstable plaque, coronary vascular disease, peripheral vascular disease. So let's talk about Alcimin. Why is it so good?
Well, it's a very potent form of garlic. The allicin is at what they call the potential that's found in the garlic clove. And as everybody knows, when you smash or cook garlic, you smell it. What you're smelling is that allicin, and that's what you're releasing when you consume this product. But when you consume a capsule of this, you're taking in over 6,500 micrograms of this allicin potential, which is where you start hitting these really therapeutic effects, as you're talking about, with regards to supporting the immune system, the cardiovascular system, it being used as a kill agent against pathogenic organisms. It's really one of nature's great gifts in the way that it works in so many profound ways. But there's too many of them on the marketplace that people take that are garlic-based products that are really denatured. They don't yield much at all. You have no idea how much they truly yield. They're mislabeled. They really don't carry the therapeutic benefit. All you're getting is something that supposedly is odor-free. But unfortunately, the health benefits are usually going to be far and away hard to get with those kind of products. So
exactly.
That's going to ensure that you can get that therapeutic effect.
Now, to follow up on that, we have a number of people that have Lyme disease, hepatitis B and C, and I don't talk about the word cure, but remission. We can put these illnesses in remission probably in a couple of weeks. And you need to stay on maintenance. Allicin Med, Silver 100 Nutridyne, then Allergon, Power C, and Nutritrala. Let's talk about these for a moment. Allergon gets rid of the cytokine levels along with the Power C, and Nutritrala, the best long-acting alpha-lipoic acid. You can add Regenerex and cell detox glutathione because you've got to get rid of the free radicals. You can also add immunoglobulins, Immunomax powder, or Nutrimune capsules. But let's start off with these core. Allergon, Power C, Nutritrala for Lyme disease. The triple threat antipathogenics, of course, are Silver 100, Allicin Med, and Nutridyne. And I tell people the very first one you want to be on is Allicin Med. And you can take the immunoglobulins to boost the immune system. It really is amazing how you can put Lyme disease basically in remission. Then we deal with the mitochondrial dysfunction with things like CoQ10, etc., the triple threat of anti-age max, Nutritrala, and Supernox. To increase mitochondrial function, we'll add D-ribose, acetyl L-carnitine, uridine monophosphate, etc., in order to increase activity. But let's talk about these for a minute, because Lyme disease is a cytokine problem. Your body is making excess cytokine molecules that are toxic to the cells in the mitochondria.
Yeah, I think that when you bring up the Power C Plus type issue, sorry, yes. Dr. Bill, I couldn't hear. Is there bumper music going?
No, and it's not a bumper. Just go ahead.
Power C Plus is one of the best ones out there because the dramatic need for the body during this fight and challenge that's going on. It's a neutral pH vitamin C, which is so cool because you won't have the trouble that you have with normal vitamin C with regards to its acidic issues and the lack of absorption. And the Power C Plus, you can take it at high dosage. It doesn't cause blue stool. The other side of it is it's enhanced with the material known as bioperin. Bioperin has been shown to increase the level of vitamin C into the blood by 40% when you take it. So when you're using this formulation of Power C Plus, you're not only getting a high-yield vitamin C, you're getting it enhanced with this additional molecule that's a really good science-based addition to the formula as well.
Yeah, now when you start taking these things, the first thing you notice is your body becomes alkaline immediately. Your cytokine level drops, so your body inflammation drops in joints. And so your food allergic reactions, your inhalant reactions, and free radicals, of course, are very high in people with Lyme disease. So Nutritrala first, cell detox, glutathione, and Regenerex. Let's talk about these last two, cell detox, glutathione, and Regenerex.
Yeah. I don't think we don't talk about cell detox glutathione enough. This is a stable form of glutathione, oral glutathione that you can take. Glutathione is the most powerful antioxidant that the body produces. But when people are in really tough spots, sometimes supplementing it directly is important. Unfortunately, most people aren't getting the benefits because it falls apart before you can absorb it, unlike this
Exactly. One. Amazing. When we come back, more remarkable protocols and examples of testimonials where people are getting healed, getting reversal of illness, getting in the zone of compensation and remission. Welcome back. And next question we have is very common, by the way, and I did an upgraded protocol, updated the 19th of April, type 1 diabetes. And it's getting more and more common, type 2 diabetes as well. First thing we recommend is berberstatin. It releases the gut peptides. Most people don't realize that diabetes is a gut peptide disorder. Not just insulin, but other peptides like proteolin, which is TRH, gastric inhibitory peptide, other inflammatory cytokines in the gut. It's really quite complex. It's much more complex than people think. You need to also take things to restore the mineral content. Oftentimes the activated minerals and vitamins are low, especially activated folic acid, activated thiamine B1, ultrathiamine B1. Diabetoline is really important for type 1 diabetics and biotin plus. You've got to reduce the pancreatic inflammation because there is antibodies and cellular immunity attacking the pancreas, so cell defense. I use Malignarest, which is basically the product we use for cancer, half a packet twice a day or 2 to 3 caplets twice a day, to actually block the hexose monophosphate shunt, the sugar pathways that are abnormal. And interestingly, they're identical in cancer and in autoimmune disease like type 1 diabetes. And then we use, of course, immunoglobulins, Immunomax, which we make a smoothie. We use, of course, the Allergon and Allerblock to block the allergic and cytokine reactions, and Regenerex. And, of course, with the advanced protocol, we'll add also the Minerals Plus, full vitamin K2 along with a Power C Plus to get neutral, and the phospholipids to help restore the tissues and cells like omega cod liver liquid, Omega Supreme, which, by the way, is a bigger size now. It's going to be 900 milligrams of DHA, docosahexaenoic acid, and EPA. So let's talk about this for a minute, because it's important that people realize that the seat of autoimmune diseases is, again, the gut. So we start off with berberstatin that gets rid of pathogens, but it also restores gut peptide levels and lowers insulin resistance. Then we get into diabetoline and biotin plus and minerals plus, etc.
Got a major arsenal for people to work through, and formulations like berberstatin, like you're talking about, some pretty cutting-edge technology where the ability to use these, berberine and berberine-blended formulations to basically restore gut function that then downstream, like you're talking about, Dr. Bill, changes pathogenic organisms in the gut, retains a better balance, and then starts influencing our whole metabolic process downstream. So, it's amazing how the science is progressing to teach us, what nature can really do and intervene for us at earlier stages than we ever thought possible. One of the better
and by the way, when you do these things, you can actually see return of kidney function, retinal function, vision. You can see a body mass index improve. You can see metabolic rate rise and their thyroid, their core body temperature normalize. You see a whole lot of things that you think couldn't reverse, like peripheral neuropathy, cardiac arrhythmias, congestive heart failure. All these things reverse. So, you don't want to just think that the conventional doctors, and again, they need to just upgrade their training. I don't think this is alternative medicine. This, to me, is functional medicine, which is a core 21st century medicine. This is not alternative. This is what should be practiced by all doctors.
Well, I think that, it's like the real knowledge comes from knowing what to use when, There's nothing wrong with having an arsenal that goes all the way to the point of, chopping something out of you if you absolutely had to. But the fact is, when to use what? It makes a lot of sense. It's no fun to try to do construction when all you have is a hammer, and you need the full tool belt. And that's what I know. People listening to you, why it resonates is because you're like, why, where are all these tools? Where have they been? And they're excited to use them and see the results. And
they get better.
Obviously, with all the feedback you get, it's making a massive impact on people that are in some pretty tough positions.
Yeah, you can measure anti-islosol antibodies to see the titer change. I started measuring those tests working on type 1 diabetics at the University of South Florida about 30 years ago. And we were measuring antibodies in relatives of people that never had type 1 diabetes. And if they got an acute traumatic accident, emotional injury, or serious infection, it could trigger off a rise in the titer, which increased the risk of a cellular immunity attacking the beta cells of the pancreas. So you can even predict if someone has a high antibody titer, they're at risk of a major trauma or emotional event or an infection, triggering off an autoimmune condition. So it doesn't happen out of the blue. A lot of people would think it happens out of the blue, just because they haven't measured the test to actually identify what the underlying problem is. In fact, they worked originally some 30-some years ago with a pediatric endocrinologist in Calgary, Alberta, and we were using at the time cyclosporin A to actually use a chemo drug to turn off people's high antibody titer against their pancreas when we had first-degree relatives that had high anti-pancreatic antibodies against the beta cells. So now we have nutraceuticals that are far superior, far safer in our chemotherapy, and that's what you need. So whether you have rheumatoid arthritis or scleroderma, multiple sclerosis, I now know how to turn it off using our nutraceuticals. Pretty amazing, isn't it?
Yeah.
people say, you can't do that. I said, I do it every day. Every day. Every day, every day, every day. People say, no, you can't. And I heard the word can't. I said,
well,
I remember the story about Forrest Gump, You can't walk, Forrest. So he had a little brace, he kept on running until he broke the screws off. That's Forrest Gump. That's the attitude we have to have.
And I think when people, can't, it's like, well, of course you can't, because you haven't worked or tried in this way. So it's like,
right.
In your mind, yeah, it's just like the 4-minute mile. Impossible. Right. Well, of course it is.
Another thing that's a big deal is people travel a lot this time of the year. And as it started spring, they're traveling all over the world. Mm-hmm. And I tell people, before you travel, start taking Living Probiotic Ultra every second or third day. Start taking Living Probiotic. Start taking Allicin Med and Silver 100. And topically or in water, Nutridyne. Really important.
Very much.
And when you start loading your body up with probiotics, you're making yourself bulletproof to viruses like the Nova virus that happen to give people diarrhea on these passenger ships, cruise ships. You're protecting yourself from, things like Haitian, diarrhea. Cholera, and all the other bad bugs. And then, of course, if you really want to bump it to the next level, you want immunoglobulins. And I recommend smoothies of Ageless and Life Support, which will help heal the gut wall. Because whether you've got a colitis or a gastritis from a bad diet or too much alcohol or whatever it is, Ageless Life Support is going to help heal your gut wall.
When you're traveling, too, not only the pressure of the foreign invaders, even when you're eating good, what you want to say is clean food, a lot of times it's bad choices. And so when you just brought up, like, the shake, when you're going on the road and you're like, I'm going to go on a cruise ship or travel somewhere, it's like packing some of this with you is just the way to go. You take glycemic meal with you, what happens is you're on a vacation that normally you're going to pack on whatever it might be, 10 pounds. You don't have to suffer that. Take the probiotic, use something like glycemic meal a couple times a day. All of a sudden, you're getting appetite regulation. You can bring Leptin Manager as an appetite regulation type formulation, but also supporting yourself that, you are going to eat some more desserts and things like that. But by using these core nutrients that your body needs, like fat-soluble B1, the benfotiamine material, the green tea and the cinnamon extract and so forth, you're able to blunt the damage that's going on. The reason our body starts stacking all this stuff because it's overwhelmed, with things that are triggering inflammatory response and high glycemic response, leptin driving, and so forth.
Yeah, another area that is very common is people are getting tinnitus and hearing loss. When we come back, we'll talk about a few principles we use there, and we can modify the protocol, but it works. Back in a moment. They can get it from traveling, eating hot food. They can get it from drinking too much alcohol. They can get it from just burning themselves with food that's physically too hot. So gastritis can be caused by a viral infection, bacterial infection, parasite. GastroHeal, let's talk about this for a minute. It is zinc carnosine. It's the most popular nutraceutical formula for stopping stomach inflammation, for healing the gut wall, gastroesophageal reflux. Doesn't matter if it's acid gastritis or if it's bile gastritis. Tell us about it and how it works and why it's so popular.
Probably one of the more important nutrients really available, because so many people are heavily dependent on products like that are what they call proton pump inhibitors, H2 blockers, and or just acid quenchers, kind of a thing that you pop because you've got such indigestion issues or GERD and stuff like that. What's so neat about this material is it's a simple combination, a very specific patented combination of zinc and carnosine, and it's a chewable. It's got virtually no flavor, but you just chew one or two with your meals, and it coats. When it touches the epithelial cells that are lining from the mouth down onto all the way through you, it has a healing effect. So the tissue that's not working all that well or being damaged by things like H. pylori or different kinds of ulceration has a chance to heal and restore itself. And so the symptoms that a lot of people have with like a gastritis type issue can have a dramatic change. And what's so neat is this is a formula that's not adding any acid, and it's not suppressing acid production, which is what everybody is doing with these kind of problems. They're either adding or suppressing, and it's causing some challenges. This is a neutral thing. You can add it right on top of anything you're taking currently. But the good news is, hopefully, you'll be able to come off of those other things. I think the average tenure, if you will, for somebody using an acid suppressive medication is between 15 to 20 years. That's not solving the problem, people.
No, not only that.
Something that long.
If you take a proton pump inhibitor, and I saw a commercial for the purple pill, Nexium, and I couldn't believe it. They say, well, you can have it delivered to your home now. So people don't even have to have a doctor oversee them. That's stupid, because in hypochlorhydria, they're going to not absorb their minerals, their foods. The protein enzymes are not going to work with their Kmax, which is the best way to absorb or break down proteins. It's really quite dangerous.
I was talking to another physician recently, and they were really they were very traditional in the sense that they said one of the hot things that they're really worried about is SIBO, small intestinal bowel overgrowth. Why? They see this high prevalence of people suppressing acid production in the body because they're they think that that's their problem. They suppress it with these different kinds of products, and then what happens is they get an abnormal pH of the intestinal tract. And they get this overgrowth of bacteria that should not be in the small intestine, climbing up out of the large intestine, infecting them, and then triggering all kinds of crazy symptoms and reactions, and it's known as SIBO, small intestinal bowel overgrowth. But it's interesting that this is a very traditional-based practitioner saying this is becoming highly aware that there's something bizarre going on in the body.
Yeah, exactly. And that never occurs, by the way. Yeah, that, by the way, when that happens, it really wrecks your small bowel. You get very leaky. Destroys enzymes. It prevents you start getting deficient in fat-soluble vitamins, etc. It's really bad for you.
Yeah, and so, but we're on this note, right? You got GastroHeal is a great thing to do. Any person out there that's trying to, recover from these things, but not even come off any medications or anything, you can just use it right on top of the way it works. Other people that, when you have symptoms of indigestion that are occurring within an hour, hour and a half of eating, like you've ate, and you're like, man, what is that thing? A bowling ball in my stomach? What? It just doesn't feel good when I eat food. A lot of that has to do with low acid levels. Your body does not generally want to overproduce acid because it's one of the most energy-intense processes it ever does. And if you eat on the run and you're running around all the time and you're under stress, your body will not produce more acid. It produces less acid, which then causes dysfunction in the way that you close your valves, like your pyloric sphincter and so forth, which may be creating your symptoms that you're feeling. So you can use something like Digestes, which is 2 forms of hydrochloric acid, pepsin and gentian root, designed to basically regulate the pH of the stomach so that it's at the right level to digest your food. And then all of a sudden, you feel a lot better very quickly. And then if symptoms occur a couple hours after eating, a lot of times that's referring more to the enzymatic function in the intestinal tract. If you're getting a lot of pain, gas, bloating, foul-smelling stools, you see food in your stool, it's not digested down. So that's where Gastrozyme is a good option to come in. And these can be comboed too, but a lot of times start people at the top, using the Digestes for the stomach first, and then see how they do. And then they can look at something like Gastrozyme, a 100% vegetarian, ultra-potent digestive enzyme formulation.
Yeah, and they often go together. By the way, if you get a QRMA machine, it tells you immediately if you have one or both problems, which they often are together. But not always, though. Now, the other amazing thing is how quickly people do get better. And when you start targeting the problem, you see almost an amazing recovery from people that say, I can't believe it, I don't bloat anymore. For example, this new product that's going to be a neutral pH lactase, the only one, by the way, in the world. When you combine that with our other nutraceuticals for irritable bowel syndrome, probiotics, etc., people get better. Another one that we have a lot of response to is the tendon mender, joint performance, and leptin metabolic. Let's talk about these again, because I just can't get over all the testimonials. I get literally 1 or 2 every day now. So the leptin metabolic.
Oh, yeah, tendon mender. Sorry, cut out for a second there.
And the joint performance. What they do is they actually supply the building blocks for the tendons, the joint cartilage, and turn off the cytokines. So explain how that works, Brian.
Tendon menders, I love talking about this one because so many people are plagued with these repetitive motion injury issues where it's a shoulder, like rotator cuff type issue, tennis elbow type issue, carpal tunnel, Achilles tendinopathies, or plantar fasciitis. These are tough plaguing issues. And what's so neat about tendon mender is this is a material that's derived, it's actually known as a glucosaminoglycan, or GAG. It's derived out of rooster combs, so it's that red part of the rooster. But they isolate a particular fraction of this material. This comes out of Europe. And when you consume it orally, it starts sending messages to the body that are just phenomenal. It causes what they would basically be a restructuring of the tendon cells, these tenocytes. They realign themselves. They stop becoming thick and sort of, if you will, they're almost like scar tissue, so they're not operating well, and they're creating a lot more inflammation. They realign, they lay back down, it cuts down on this pain inflammatory process. All of a sudden, the joints start moving normally again. It is literally giving this reprogramming message to these very difficult areas to reach in the body. So the tendon bender has been a huge success with regards to people that are really struggling. Joint Performance uses a different component of rooster comb, again, a different version of glucosamine that actually is driving what's called hyaluronic acid levels in the synovial fluid and joint tissue. And what that means is our joints are surrounded by this capsule. It's got to have this fluid in it. It has to be ultra viscous, meaning it's got to be like ice on ice, right? Very slippery and smooth. If that's not occurring, and you put even 1 grain of sand on there, it doesn't feel good. It doesn't work right. And so when you can induce more of this hyaluronic acid production, and you can lower what's called synovial effusion, or kind of the swelling and inflammation that's occurring, all of a sudden it's going back to ice on ice. And so the Joint Performance formulation is all about kind of like an oil change, smoothing it out, making it like ice on ice again, and all of a sudden it is working really well for people that have joint discomfort. It might be the weekend warrior not recovering well from their athletic performance, so forth. And then the other one that's quite unique, Leptin Manager, that I kind of quickly spoke about, but when it comes to the idea of appetite control and so forth, that's another new one.
Yeah, our leptin metabolic, the one that works, it has dual use for reversing osteoarthritis and for reversing diabetes and obesity, the underlying leptin and insulin resistance. The leptin metabolic is pretty amazing. Yeah,
leptin metabolic is a phenomenal thing because it's really realizing this is one of the first substances that has been uncovered that shows in humans when you take it, it's getting this leptin sensitivity created in the body. And when leptin becomes sensitized, that's a message that comes out of the fat cells, leptin does. So when you have excessive fat cells, which many people do, this message needs to be heard so that you can control your appetite and your metabolism in the body.
Yeah, and of course, if you want to stop inflammation, I recommend Inflamex for musculoskeletal and for solid organs, Cell Defense, and Regenerex. Amazing. No non-steroidal anti-inflammatory is dangerous. Don't ever use them.
Everyone, I think Dr. Bill will be back in just a couple seconds. He had to step away. This is Ryan with the NutriMed line. So while Dr. Bill is making his way back to the studio here, we'll hit on a couple other highlights that I know towards the end of the week that's very important for people. Oh, there's Dr. Bill.
Yeah, I'm back.
I was just going to introduce one of my favorites for the weekend. I know it's not Friday.
Do that. But, put it in.
I throw it in there to make sure that people always remember about Calm Mind. There's so many fans of it out there already, but so many more people that need to know the benefits of what this formula is.
Actually, the tagline below Calm Mind should be, you're living in, put the name of the country or city or town, and you're kidding, you're not taking Calm Mind? Or the other tagline should be better than
here. Yeah, it's what's neat is when it comes to how our brains are working. Let's face it. You want to raise your hands. How many people are dealing with what they feel is a lot of anxiety? You wake up, you're anxious throughout the day. Things are coming at you, bills, problems, whatever. You got college tests, whatever it is, and it wears us down. And you can understand that the fact that nutrients get worn down. Well, there's a particular nutrient that is in this formula known as myo-inositol. It's in the B vitamin family. When you take a scoop of this, you're getting a high amount. You're getting 2 grams of this myo-inositol, but it's also enhanced with taurine, magnesium glycinate, a little bit of GABA, and a little bit of L-theanine. And the key is, though, this myo-inositol works in our bodies as a secondary neurotransmitter messaging molecule. What that's saying is, if your body's trying to give messages that say, hey, you can calm down now, you can relax, we don't need to be overly stressed, you don't need to be raging, you don't need to be craving sugar, craving alcohol, craving drugs. If you're lacking this, it's very difficult for those messages to get where they're supposed to go. By re-enhancing this level in your body, all of a sudden the body goes, no, it's 9 o'clock at night and I really don't want to eat ice cream. It's 5:30 in the afternoon. I had a drink and I feel totally fine. Like I don't even want another drink. Or, it's 10 in the morning and you're freaking out because of anxiousness and you take 2 scoops and in 20 minutes, all of a sudden your body goes, I'm not really sure why we were so fired up about that. That's the kind of balance people are looking for, and they usually have to use medications of some sort to blunt themselves. The fact is, we're probably dealing with a lot of nutrient deficiencies, and so when it comes to Calm Mind, it's a life changer across the board.
Right. And by the way, in terms of neurotransmitter balance, we use Cognition Plus and Brain Power. But the calm mind, I tell people, as I say, once in a while I'll get somebody that'll accuse me of being a cult leader. I said that possibly is true now because we have our own Kool-Aid.
Yeah, because the cherry flavor is phenomenal.
Cherry flavor, yeah. No, I'm just kidding, of course.
And it does kind of taste like.
But this doesn't kill you. This makes
drink.
you feel. This makes you want to live, not die, like the Jim Jones. So
yeah. Well, then there's the neutral version too. That for any kid, any flavor, any palate, it's just neutral. It can go straight to water.
We have a neutral pH. We have a neutral flavor one you can mix in coffee or tea or mix up in seltzer water or whatever that has no flavor at all. The amazing thing to me is that we can use combinations of these to get rid of all kinds of toxins. If women say, I don't want breast cancer, and they're using a lot of hair dye and they've got lots of co-exposure to chemicals, we say xenoestrogen detox, NutriDefense. Let's talk about xenoestrogen detox, because a lot of people think it's just estrogen. It's for men too. These are the xenotoxins that get in your prostate. And I had a man the other day said, I don't know, that sounds like it's a woman's thing. No. Estrogenic toxins basically look like the estrogenic molecule. It doesn't matter if you're a man or a woman, it's going to lock on those receptors and make your prostate gland grow. It's the German term is called Ergenlagen, the same prostate tissue as the uterus in females, from the rest cells in the embryo. And when you take xenoestrogen detox, it starts to get these chemicals out. We use also Proline Sauna and Nico setting on Lumen Photon, but you need xenoestrogen detox in there. I also recommend life support and bio-LVR. So these are the three biggies for detox, or those three.
Yeah, that's estrogen detox. Good point. I mean, it's very easy. Anything that says estrogen, people are like, that's for girls. It's like, no, we're all being bombarded by these estrogens. You know why? Hey, guys, are you ever around fuels? Are you ever around plastics? Are you ever around drugs, that you got to consume and so forth? All these things carry high levels of estrogens. It's one of the biggest stories, really, in the 21st century is
I call the bombardment
of these abnormal estrogens in our environment and how they basically are they're destroying our bodies. So anyway, xenoestrogen detox is about neutralizing these substances before they do damage to the tissue, and also making sure that, hey, we all produce estrogens, that you metabolize them properly and shift them out of the body so they aren't building up and doing this damage like you're talking about, Dr. Bill.
Yeah, exactly. Now, also when we have people that are trying to recover from serious health problems, they don't realize that you need a kind of, like, let's say heart disease. The first thing you want to do is increase nitric oxide. You can use test strips for nitric oxide. And I recommend first Supernox and Cardivite, magnesium glycinate malate, magnesium taurate for protecting the ion channels. You need to increase your magnesium dramatically. You need a gamma E plus, and you need to, of course, use things to reduce blood viscosity like nattokinase. When you start using free radical scavengers like Nutritrell, Cell Detox, Glutathione, and Regenerax, you literally cut out the possibility of oxidizing fatty acids and trans fats and ending oxidized cholesterol that causes your heart disease. So if you follow our protocol for heart disease, it's just virtually impossible, despite genetic issues. If you change your diet and get it reasonable, and you take our nutraceuticals, it's virtually impossible to develop plaque. And you can prove it. That's what's amazing. Nattokinase, let's talk about that one. Gamma E plus, magnesium glycinate malate. This is very important. If you don't have adequate magnesium, you can't counter calcium. And when people say, well, it's important with Supernox to have nitric oxide, infrared sauna also increases another 40%. But you need Supernox, you need these nutraceuticals to get the body to get the nitric oxide production up so the blood vessels relax, the blood viscosity drops, the inflammation of the blood vessel wall decreases. It's also important.
Absolutely. This Supernox is the aspect with regards to nitric oxide production, too, is people oftentimes are just going to go to the health food store. They're going to say, hey, I heard arginine is good. You got to be careful. Arginine very quickly. It's got a 10-minute half-life. And so you spike it really quick, and unfortunately for a lot of people, it won't necessarily convert to nitric oxide effectively. And what happens is you leave it in an unconverted state. It becomes, part of it will become peroxynitrite, a very nasty free radical that creates inflammation. You don't want that. So when using Supernox, what makes it so unique, it's a patented extended release formula, so it goes out over many hours. It also is enhanced with a very particular compound known as actinose that allows for a very high conversion rate of the unique arginine that's in the formula, which is known as arginine alpha-ketoglutarate, patented compound out of France. over to the nitric oxide. So you're not leaving it hanging there, and you're also not just flooding it into your system with a very short half-life. So by using Supernox, you're really protecting yourself and able to enjoy all these benefits. And I'll tell you, for going and weightlifting and exercising, for what it can do on the circulatory side of things, as well as the topics that are revolving around cardiovascular issues, it's an amazing formulation.
Let's revisit Vitamin Mineral Max and Minerals Plus. I tell people these are foundational. You'll see also all those minerals in Life Support, Ageless Energize, the glycemics, etc. They're all the activated forms of vitamin. No other vitamin company, nutritional company, has all the final activated forms. All the minerals are Albion Trax chelated, which is the most advanced mineral delivery system in the world. There's nothing to compare to it. So let's talk about these two, Vitamin Mineral Max and Minerals Plus. And even if you just take one a day each, they're so vital for all the mineral deficiencies in our diet and our lifestyle. Why should they take them?
Well, got to have the activated forms. I mean, people are taking all kinds of nutrients, but if they're not in the forms that your body can utilize, then many times it's not doing you any good. In some cases, it's doing you harm. Like take B6, for example. What you're seeing in these formulations, like Vitamin Mineral Max and like Life Support and, these various formulas using these activated forms. And so what we don't realize is that each one of us has weird genetic SNPs. And these SNPs cause us not to utilize things like we should. People are hearing more and more about that with folic acid, so you see the cutting-edge version of that. But for me personally, B6 is another one that if I don't use the activated forms, I end up with a neuropathic pain in my feet. And so why not just skip the pain and use the activated forms like you have?
Exactly. So important, so important. Amazing discussion, Ryan. Enjoy the weekend. We will be back, of course, Hour 3 with Tim Alexander, top review of the history, geopolitical, military strategy. Chris Harris, our nuclear expert on what's happening with the nuclear reports, from 60 reports from the previous director of the Nuclear Regulatory Commission, and the latest on Fukushima. Tomorrow, of course, first hour is the firing line. Get your questions and your requests into Michelle. And, of course, our preparedness update with Ed, John Moore, and Ann Morrison. Back in a moment with Hour 3. Stay tuned to the NutriMedical.